Regarding the clinical presentation and some of the clinical manifestations that have already been discussed, there are some signs and symptoms are the one which by which the patient will report to you, and the signs you have to look, the doctor actually, the consultant have to look it up. Okay, so the patient can complain of a sore right upper quadrant, that means right hypochondrial pain. The patient can have epigastric pain as well. Some of the visual pains, like some people can say they have a pain radiating to the back of the chest, or there can be nausea, there can be flatulence, there can be bloating, there can be dyspepsia. So these are the some of the signs which can actually take place in a biliary colic. So how you actually define as a biliary colic? Biliary colic is defined as a severe episodic pain which remains for a few minutes and then it goes off on its own. So that's actually called as a biliary colic, and it can be associated with the nausea, it can be associated with the epigastric pain, it can be associated with the bloating and flatulence and dyspepsia. So the important thing is, like, the patient will report to you, and especially the pain actually starts in the midnight, and it's like episodic, and it comes like a wave, and the patient will report to you that he had severe episode of a pain in the right hypochondrium or in the epigastric region, and after some time it was being spontaneously resolved on its own without taking any medication. And then patient can also complain of vomiting if it's a biliary colic, not the acute cholecystitis, it's a biliary colic. So the episodic pain combined with the vomiting or nausea, that is a presentation of a biliary colic. But there can be some other presentations when you talk about the acute cholecystitis. Okay, the symptoms would be the same. The patient will report to you with the right hypochondrial pain, with the multiple episodes of vomiting, and when you try to examine that patient, is very, very tender to touch, and maybe there can be guarding. So, or there can be mass palpable in the right hypochondria, because whenever there's inflammation of the gallbladder, the omentum actually covers up this area to protect the underlying viscera. Okay, so that mental caking, or you can say mental mass, can be palpated when you're trying to examine a right hypochondrial pain. And the Murphy's sign can be positive. So what do you mean by a Murphy's sign? When you try to deeply touch the right hypochondrium with the fingers and with the pulp of your fingers, okay? You try to push them, and you ask the patient if there is any breathing difficulty. So if the patient is actually complaining that the patient is experiencing a breathing difficulty whenever you're pressing deeply into the right hypochondrium, that means the Murphy's sign is positive, which is the indication of acute cholecystitis. Some people say that Murphy's can also be positive in a chronic cholecystitis, but it's more specific to the acute episode of a cholecystitis. So one presentation is a biliary colic, another presentation is a cholecystitis. So biliary colic is mean there was a stone in the gallbladder, and because of there can be some mild obstruction, and that mild obstruction causes vomiting, that causes severe episodic pain, or there can be some other associated features. But when there is obstruction and there is a stasis of bile within the gallbladder, the possibility is that there is associated infection as well. So whenever the gallbladder is infected or inflamed, so that will lead to the tenderness in the right hypochondrium. And the Murphy's sign would be positive, and there would be fever. The patient will complain of fever, high-grade fever, and whenever you're going for some laboratory investigations, there would be an increase in the total leukocytic count. Other than that, sometimes there's a stone in a gallbladder, but it slips all the way down from the cystic duct, and sometimes it causes obstruction to the main pancreatic duct, and it can lead to the acute pancreatitis. So the patient would be complaining of epigastric pain more as compared to the right hypochondrial pain. And the clinical term we use for this category or this condition is called as biliary pancreatitis or gallstone pancreatitis. That means that this episode of a pancreatitis is not related to any other conditions like idiopathic or alcohol or some other systemic conditions or ERCP, but this condition is secondary to the gallstones. That means the stone all the way slipped down from the cystic duct or common bile duct and it's obstructing the main pancreatic duct and it's causing inflammation of the pancreas as well. So these are the presentations, and the other one is the mucocele already being discussed, the empyema already being discussed. You can say these are the complications. These are not the presentation. So presentation can be chronic cholecystitis, acute cholecystitis, or the biliary colic. Biliary colic is the most important and most common one. Some patients remain asymptomatic, but if the patient is repeatedly having biliary colic or recurrent episode of acute cholecystitis, then obviously he should be under the knife for cholecystectomy.